proceed.
Okay, thank you. I appreciate it very much. I'll go ahead and start with Dr. Galler again. Our nation is in the midst of a suicide crisis, as you know. Over the past several decades, the suicide rate has risen sharply, increasing 31% since 2001. At the same time, emergency departments, which are often the place within our healthcare system that provides care for people who are at risk for suicide, have inconsistent protocols for screening and treating high risk patients. For this reason, I introduced H.R. 4861, the Effective Suicide Screening and Assessment in the Emergency Department Act. This bill will assist hospital emergency departments in improving their ability to identify and treat those who may be suicidal. What is the potential impact of COVID 19 on the risk for suicides, and what role can hospitals, especially emergency departments, play in identifying and treating individuals who are at risk for suicide? Dr. Geller, please. Thank you.
The effect of COVID on suicide is substantial and actually multifactorial. One is the response to an individual in the stress of the potential for infection. Another is grief, loss, and significant depression from people who are losing family members to COVID-19. And the third, which is probably the newest information, is that we are seeing in some recent data from the United Kingdom that there's a direct neurocognitive effect on some patients from the COVID. That is, it affects their brain. There's an increased risk of strokes, and there's all sorts of other psychiatric presentations. So we have three rather distinct ways that COVID is significantly affecting suicide. We're not doing something right in this country. Of all the developed countries in the world, we are the only one, the United States, who is seeing an increased rate of suicide. All the other countries are seeing a decreased rate of suicide. I think your bill is extremely important. Not only should we be doing suicide screening for people who show up for psychiatric problems, we should have a high index of suspicion of people who show up for other reasons. Just like we have a high suspicion when a kid shows up with a bunch of broken bones that maybe there's parental abuse, we need people who, when they're doing the evaluation for whatever reason, are paying attention to a suicide risk. We also need then continuous follow-up, as is covered in some of the other bills, so that people don't get lost the day or minute they walk out of the emergency room.
Thank you very much. Ms. Gross, thank you for your testimony again today. I've seen firsthand the power of Sandy Hook Promises work and Save Promise clubs at Palm Harbor University High School, where my kids go, in my district last fall. And I agree with you that students are equipped and able to prevent all forms of violence. Congressman Peters and I led the recent introduction of H.R. 7293, the Suicide Training and Awareness Nationally Developed for Universal Prevention, the Stand Up Act, which encourages states, tribes, and schools to create policies for student suicide prevention training utilizing the SAMHSA provided best practices training and technical assistance. You mentioned that the Save Promise Club trained you on how to notice the signs and talk to your classmates who may be struggling. And you've done that, and we appreciate it so much. If students like you weren't trained in your school and there weren't Save Promise clubs, what do you think you and your classmates would do if they were struggling with mental health? If you could answer that question, I'd appreciate it.
Yes. First of all, I'd like to thank you for that question. Thank you for supporting the Stand Up Act. I think it's so important. And in my mind, or in my perspective, kids would begin to start showing signs. Kids would show signs that they are going through something, but they wouldn't be able to express it because a lot of kids don't feel comfortable doing that. So you might see a lot of kids getting into fights because that might be the only way that they can get out this aggravation or self-harm, because they wouldn't have anyone who is like them, like another peer or student that's going through the same thing to talk to. They wouldn't have someone to relay that on. So you would see kids, maybe their grades would be dropping, which could ruin their future, really, because, colleges and all that stress really put on you, it just will lead them closer to losing their lives. So that's why I think, in my perspective, the SAVE Act is so important because it allows us to save lives by being there for people who are like us and allow students to step in and help and give another hand to something that is so important.
Thank you so very much, Madam Chair. I guess I don't have much time left. Well,
Well, we all wish
Anyway.
we had more time, but the gentleman
Okay.
yields back, and thank him for his excellent